It's Mari McInerney from Croaky here at the Advanced Pharmacy Australia's conference, Medicines Management, and I'm here with one of our keynote speakers, Katherine. Can you introduce yourself, please?
Sure, I'm Katherine Isoardi. I'm an emergency physician and clinical toxicologist based up in Brisbane, working at the Princess Alexandra Hospital and also the Queensland Poison Centre.
Fantastic. Now, you just presented on synthetic opioids.
I did.
But that may not be our biggest problem. But can you just take me through what your main points were in that presentation?
Yeah, look, I did speak about synthetic opioids and particularly about nitazines. So they're a drug that we're starting to see more and hear more about, and we're starting to see it more in the illicit drug market. So we first had detections about 5 years ago. So nitazines are a synthetic opioid, they're very potent, and in Australia they're not popping up all that often, but when they are popping up, they're popping up in really dangerous situations. So we're finding them in substances where people aren't expecting them, so things like ketamine or THC or benzodiazepines, rather than people thinking that they're using opioids. And so we're finding that this has the potential to cause a lot of harm, and certainly there's been some deaths that I'm aware of, maybe 20 or so in Victoria, but similar numbers up in Queensland related to nitazine poisoning, because ultimately they're really potent opioids, and opioids are related to overdose deaths.
And the difficulty is that people come to hospital, and if they're able to say, or if someone with them is able to say, they don't actually sound the alert, and so they don't get the treatment.
Yeah, we've looked at a small number through their EDNA study. So the EDNA is the Emerging Drugs Network of Australia. We've looked at the group of nitazine poisonings that we have in our data set, and it's a small number, about 30 odd across the whole country over the last 4 years. But in that group, only a sixth of them actually knew they were using nitazine. So that meant that 5/6 didn't know they were using a nitazine at all. And more concerningly, almost half didn't know they were using an opioid. So even though this was something we could find in their blood when we tested them, they didn't know that they were using them. And that group mostly came in with typical sort of features of opioid poisoning. So we see people with small pupils who have respiratory depression and who have sedation or coma. And we've got a very good reversal agent, naloxone, but what we need to have is these people in hospital so that we can give it to them. So if people are using this drug out at home, out away from a healthcare setting, and they're not knowing that they're using opioids, they can turn out to have a lot of problems and harm.
Where does that shift happen then? Is it the health settings have to change? Is it community awareness?
I think a community awareness would be a great start. I think that there needs to be a lot more safety messaging about things like naloxone for people who are using drugs, even if they don't realise they may not be using an opioid medication, because we're seeing them popping up in designer benzodiazepines, in counterfeit opioids and the like, including other tablets you just wouldn't expect, or even THC vaping products. You know, I think that people would be thinking they're vaping THC, and then they actually have a nitazine in there, and really small amounts of this compound can lead to profound opioid toxicity. So it's more a messaging that if you're using drugs, unless you know what you've got in them, you've been to a pill testing centre and you know what's in it, that you make sure that you're using with other people, so that if anyone ODs, that healthcare can happen. You know, an ambulance can be called, naloxone can be given, and used with other people. You know, used safely.
Now, your point was that you'd like people to be in hospital so that they can be given naloxone, but you also did suggest that maybe we should all have it in our bags at some point.
Look, I think that naloxone is the reversal agent for opioid toxicity. It is cheap, it's readily available, it's been around for 50 years, we know how to use it, it works really well. There's a take-home product that, there's a number of take-home products that are available. There's an IM one called Pronoxad in Australia, or there's an IN, or intranasal formulation called Nixoid. And I think that people should start thinking about carrying, you know, Nixoid around in case they do find someone who has OD'd, because it is simple to use and it can be life-saving. You know, it can reverse opioid toxicity, get someone breathing again, and save a life.
And when you say people, do you mean everyday people? Everyday
people. You know, look, I think that opioid use disorder no longer is, you know, what we used to see in the movies of people who were, you know, heroin users back in the day, scruffy and wandering around. Like, opioid use disorder now, you know, afflicts people who have had a musculoskeletal injury and discharged on opioids from a hospital, and then have an ongoing opioid use problem. And so, you know, a lot of people have it. And opioids are the main cause of overdose-related deaths in Australia. You know, there's more deaths due to opioids than there are due to traffic accidents each year. So it is, you know, by and away our biggest substance issue. You know, we've got ways of mitigating harm, and naloxone is one of them. And having that message out of how to safely use if you are using is very important.
And you said it hits the media headlines a lot, but does that skew the understanding?
So I think synthetic opioids in particular hit the newsline a lot. It's always, newslines like sort of sexy new things and an ultra potent opioid that is 1,000 times more potent than morphine. There's a lot of, messaging that sounds great for a news report. We're not seeing a huge number of netizens, and that's a good thing, but I think that the potential is definitely there. In America at the moment, they have an awful opioid epidemic, and it's mostly fentanyl, but it is causing a huge amount of harm, loss of productivity and deaths, and it's awful. And if that sort of problem came across to our shores, I think we'd be looking at a huge opioid problem. Whether it would be nitazens or whether it would be other potent opioids like fentanyl, it's hard to say, but the potential's huge.
So your calls to action, do you have for government, healthcare settings, general community?
I think for the calls to action, I think there's a lot of things that are being done on this, and I think that it's being appreciated certainly in the levels of the health system as to the potential and what problems it could be. I think the messaging to users, particularly young users who have access to the internet and that's where they're getting their substances from, is again that messaging of use safely. I think it's very naive for us to think that kids aren't going to use drugs. So although obviously abstinence is the best, like I think if you're going to use safely, use with other people around you. So if there's a problem, help can be called. Carry naloxone, and where you can, use pill testing facilities that are going to tell you what's in the substances that you're using, just to make it that much safer.
I guess that's an interesting point though, where you can use those. Is there a political blockage to this?
There is. So in Queensland we do have 2 pill testing facilities, one in the Gold Coast and one in Brisbane. Their ongoing viability may not be as steady as it was since the most recent government came in, but I think there's a role for them, and I'm someone who would advocate for people not using drugs. All my day is, I would love it if I didn't have patients. It would be fantastic, because I see all of the awful things that can happen and all of the complications that I think a lot of people don't know happen. You have long lie, and then you get muscle breakdown, and then you lose your leg. Things that I just don't think people, when they went out that day and decided to use substances for whatever reason, it just, I think those sorts of harms don't actually enter their mind. And so I would love it if I didn't have any patients, but I will have patients. We'll always have these problems. And I think that the messaging, and particularly for young people who aren't aware of it, should be how to use safely.
Fantastic, Katherine. Thank you very much.
No
Is
problem.
there anything else you'd like to say?
No, I'm good. Thank you for having me.
My pleasure. Thank you.
Cheers.